what's available for weight loss ever in the history of this country. So I'll delineate a history here of what's been out there. Phentermine's been available for a long time. It's known as Adipex, phendimetrazine, Bontrol. A less well-used one called Orlistat. It was Xenical and over-the-counter eventually later as Ally. And people don't want to take this because they end up in the bathroom too much. There's one called Contrave, and then a newer one, I can't pronounce the brand name, but setmelanotide. That's really interesting because that kind of snuck onto the market last year, the same time that the FDA pulled a lot of the peptides off the market. The melanotan 1 and melanotan 2, you can see it even in the name of the drug. It's a melanocortin 4 receptor agonist that helps in severe obesity that I haven't seen used yet, but it is out there and FDA approved. The current effective weight loss agents that are being used are the glucagon-like peptide 1s. That's the GLP-1s. The first one on the market was exenatide by Durion. It is not FDA approved for weight loss, but it is out there. It has been used. And there's one in China that just got approved last year. I'll call it benaglutide, but it's 3 shots a day. That's a pain, but that's out there. Liraglutide, one that we're pretty well familiar with, came out on the scene 10 years ago now, is Saxenda. And then semaglutide, which has kind of swept the nation. It's been pretty effective, officially approved in 2021, called Wegovy. The newest to the market in 2023, the weight loss agent for tirzepatide is Zepbound. Mounjaro is the diabetes equivalent. And then there's one that's been tested already in a 48-week human trial called retatrutide. It's a triple incretin. All these are incretins, and they have different physiologic effects, which we're going to go over in just a second. But that one's coming. We don't know when that one's coming. I don't have a brand name for it, but it has even better weight loss potential. So these are the effects of GLP-1s. These are the effects of gastric inhibitory polypeptides, and this is all that in summary. This picture is a lot more representative. The GIPs over on this end, the GLP-1s on that end. Remember, that's semaglutide. This is tirzepatide, and then this plus is going to be the retatrutide for even better weight loss. But you can see there's a lot of great benefits for these. In the brain, increasing memory. The GLP-1s decrease your hunger cravings. In the pancreas, they increase insulin output, which isn't a bad thing, but it also increases insulin sensitivity. These fancy things, beta cell apoptosis, basically it makes your beta cells, which are the cells that make insulin, not die as quickly, not wear out as quickly, and it helps them to proliferate and make more of them. So therefore, as a diabetic, if you were diabetic, you last longer. So there's this theory that beta cells eventually kind of peter out and die off, and everybody eventually ends up on insulin, which is not the case on these incretins. They delay gastric emptying, therefore you feel full longer in the gut level, not just at the brain level. And then they have cardiovascular benefits as well. They have fat cell benefits so that you actually get more fat accumulation, but this is a healthier fat accumulation, and it does allow fat burning better. And then we don't hear this very often, but the GIPs increase bone formation. They're even going to be studying the GIPs in osteoporosis. That's definitely being foreshadowed coming up. So you can see there's a lot of health benefits in these incretins, the GLP-1s and the GIPs. Tirzepatide has a better side effect profile, it has overall better weight loss, and we use it in those who have untoward side effects to just the GLP-1s. If they get more nausea, tirzepatide, when you have all the things, helps to attenuate that nausea and they tolerate it better. It is a little more expensive. I wanted to cover that real quick. So you have to weigh that out there, but if it's covered, Zepbound is going to be probably better for them if they have side effects to the semaglutide. I can't talk without mentioning our natural alternatives, and there's two key ingredients that we have in our Metatrim product, berberine. It's bitter, it comes from natural plant sources, but it mimics incretins. So you get lower blood sugar, lower cholesterol, lower blood pressure. It helps in polycystic ovarian syndrome, and it helps, of all unusual things, improve gut dysbiosis for those with reflux, chronic bloating, symptoms like that, and it promotes satiety at the gut as well as the brain level. The other one is hibiscus flower, and it's used concomitantly with the berberine, and it does similar types of things and a different mechanism. We have those put together along with some other agents in Metatrim on mdblend.com. This lowers cravings, improves satiety, supports heart health, and there's no stimulants, no fillers, and or any preservatives, and that's a big deal for a lot of people who certainly can't handle those older agents, the stimulants like Adipex and Bontrol. So with Metatrim, you can lose weight naturally.